Hi, and welcome to the Working Differently in Extension podcast. I'm Bob Birch. Great to have you along for today's show as we're going to have a conversation about mental health issues and what extension educators should be aware of regarding mental health issues and how we can maybe help out our clientele a little bit if they find themselves in those situations. Our guests today did a workshop on this issue at the National E-Extension Conference in San Antonio a few weeks ago. And they're both from Ohio State University Extension in Hardin County, and will be joining us from there. Jami Dellifield is a family and consumer science educator at Ohio State University Extension. Hi, Jami.
Hi, glad to be here.
And Amanda Rains is a 4-H program assistant at Ohio State University Extension in Hardin County. Welcome, Amanda.
Hello, everyone. Glad to talk to you today.
So thanks again for joining us on the podcast. I'm really interested in sort of delving into this topic. And maybe we could start with, as extension educators, why should we be aware of these mental health issues?
Okay, well, mental health is something that's impacted both of us on a personal level. So it's important to us and we're pretty passionate about it, but mental health will impact 1 in every 5 American adults. So that's a really big population. Every day as an extension professional, you will meet someone, whether you know it or not, who is dealing with a mental health issue. So I just feel it's very important that we be aware and we know how we can support and how we can connect people with the resources they need.
And there is a stigma that seems to be attached still, even with all of the education that we have available to us around mental health problems. So the more we can educate ourselves and stay ingrained in the research that's happening around the things that are going on, whether it's with our young people or our adults that we are serving, it just helps us be better at what we do. And that's what we're always striving for in extension, is to just keep making the best better. So we want to make sure that we are helping with that as well.
I think you mentioned in your workshop description, that sometimes we might have a limited idea of what we're talking about when we talk about mental health issues. And so what are the kinds of things that we might run into as extension educators that fall under that umbrella?
All right. Well, first of all, it would be one that we're all common. I mean, it's very common to all of us, would be substance abuse. When you're dealing with that, you could have an individual who could come into a program who might be under the influence of something like that, or a person who is fighting a battle to stay healthier. So we don't always get the chance to know our clients' backgrounds, but being aware that that is something that could happen. Anxiety disorders, depressive disorders, eating disorders, bipolar, schizophrenia are some of the big ones for adults. When we're talking about teens, we're also talking about cutting. We are talking about increased sexuality that sometimes comes and is a systemic, a secondary sort of symptom. Sorry, my brain went dead for a second. Secondary symptom to some of the other things that are going on. So just being aware that there is always something happening upstairs while someone is sitting and talking with you and with listening. So those are some of the big ones that we talk a lot about.
And Jami mentioned anyone could walk into your program experiencing a mental health crisis. We've dealt with it several times at 4-H camp where we don't have a parent right there with us. And it was very eye-opening to me last year, the experience we had and how ill-prepared I was. Even though I have a personal experience my entire life, I've dealt with mental health issues in my family, and I thought, if anyone is prepared, it's me. And I just was not prepared at all for the crisis that we faced at camp. So that's why I think it's just so important, because whether you're at camp or fair or at a program or even at your annual conference with your colleagues, knowing what to say and what not to say is pretty important.
And recognizing the symptoms when someone is under an attack. For example, I suffer from anxiety disorder, and there are certain triggers that I have. I am very upfront about it, but it's really important for my colleagues to know, because they can help me take time away and we can work through. One of my big ones is if you send me an email that says I need to meet with you, but you don't tell me why or say it's no big deal, it will send me into, oh my gosh, what did I do wrong? And there are things that we unintentionally could say or do in our programming that could have an adverse effect and a negative effect on someone without even knowing it. So being aware of it and being open about it. We don't talk about it. If someone has cancer, we talk about it. If someone is pregnant, we talk about it. If someone has diabetes, we talk about it. But we don't talk about what's happening upstairs all of the time because we're afraid and we don't want to hurt anyone's feelings. But this, we're lucky enough to do a mental health first aid training. It was an 8-hour course, and that's what we're really encouraging our colleagues to seek out and to take, because it really lays out the steps of what we need to do, and to not be afraid to refer out and to not be afraid to ask hard questions around these issues.
Amanda, you mentioned an experience at 4-H camp. What can you tell us about that? Maybe give us an understanding of what you dealt with and how you dealt with it, and maybe where you learned, hey, we need to do better.
Mm-hmm.
Okay, sure. We had a camper, and every year, you fill out the health forms. You're all familiar probably with the certain types of medical histories that youth have to fill out when they're with us for an overnight experience. And so on our health form, one of the boxes that they can check, yes, I suffer from, constipation, diarrhea, vomiting, anything like that, homesickness, bedwetting. One of the boxes is anxiety. So we had a youth, and she had checked that she had anxiety. And in my mind, anxiety was additional worry, being, just kind of a little tense all the time. Well, it turned out she has PTSD from a traumatic event in her life, and that was not something that we knew of. We did not know her triggers. We did not know what the plan was if she had an anxiety attack. And one evening at our camp, we have a very emotional type ceremony, say goodbye to all of your friends, especially our last year counselors, and it's really emotional, and all of the kids are crying, or just really kind of upset because they're moving on. And she, that triggered her to have a full-blown anxiety attack, where she wasn't just hyperventilating and saying, I can't do this. She was unable to speak, unable to control her body, was pacing in a dangerous hilly location that had lots of obstacles. You could not speak to her. She did not recognize. She thought somebody was trying to get her. It was just terrifying for me as the adult in charge, not knowing what to do. And when we finally did get her mom on the phone, she said, there's nothing you can do. Don't talk to her.
We were doing everything wrong.
Everything we were trying to do to help was exactly the opposite. We were making it so much worse. And we ended up having to call the squad, and they had to take her to the emergency room and medically sedate her so that she could come out of that attack. And it was just, I just felt like I had really let down this camper, and I had really let down the other girls around her who had witnessed it, because I couldn't fully explain to them what was happening to their friend. So that was we're going to have a plan. When my youth check that they have some of these mental health issues, I'm going to create that plan before camp with them and their parents. I want to know what could possibly put you in this situation, and how can I make camp the best experience for you? How can I make 4-H the best experience for you? So that was my eye-opening. We have to be more. We have to know more. We have to do more.
You mentioned, and in this 4-H realm, and so many of us work in 4-H, even if we are maybe not titled 4-H in our positions. And one of the things that you mentioned in the workshop is the fact that a lot of these disorders sort of start in our the kind of teenage years. So it seems like that would be a place to really focus. And the fact that 4-H is sort of more high touch than a lot of our interactions are.
And the teenage years are difficult years. It's difficult to be a teenager, and it's difficult to be around a teenager. So really learning about these mental health and the different issues that could come about can help distinguish, is this a person who's developing a mental health disorder? Is this a person in mental health crisis? Or is this a grumpy teenager? Is this something more? And sometimes it starts as a teenage problem and it can become something more. But what I always like to remind my adult volunteers is whether they're going through something like their first breakup or something more substantial like grief, an experience is an experience, whether you're 13 or whether you're 32. So what they're going through for them is very real, even though we say you're young and this will be easy, we'll get through it. To them, this is their moment. This is their life right now. So we need to be able to speak and have conversation and acknowledge that. And that will bring us closer to our youth and, build the trust, and they'll realize the importance of what they're learning if we're on the same level as them and respecting that their experience is their experience.
And one of the national surveys that we have been made aware of states that half of all mental disorders will begin by the age of 14 and 3/4 at the age of 24. So that is really our young adult population. But we also know that mental health issues and problems can start because of life triggers. So even those in agriculture, depending on what is happening, that can, just the anxiety of not knowing what your crop is doing, or if you're going to be able to, it's just stressful. Life is stressful, and that causes a lot of these. So sometimes we can cycle in and out of it, but it's when we can't cycle out of it that it becomes a problem. And you never know when the trigger will happen. But because adolescence is so tumultuous, and we're in an age where so many kids are online all the time and not interacting with people, we haven't developed some of those social coping mechanisms either, which is why we're seeing, I think, a higher onset of mental health diagnoses.
Jami, I'm glad you brought up the agriculture issue. So I'm getting a little bit of feedback, so I just muted you guys. So maybe what we'll do is when you're talking, when I'm talking, you'll be muted. When you're talking, if you can unmute yourselves, that'd be great. So I'll edit this out, by the way, of the audio. But I'm glad you brought up the agriculture thing, because in doing a little bit of work, preparing for the podcast today, it seems like there's some work going on this idea of agriculture specific mental health issues because of the stressful nature of the job and some of the things that might come up there for farmers. And I think it's definitely something to be aware of, especially for those agents who might be listening to us and going, well, yeah, I get it, 4-H camp and young people and where these kind of situations could arise. But hey, I'm just, I go and deliver my workshop and, or answer questions for a particular producer, and I'm not going to run into these issues. What do you think about that, I guess?
Well, in my experience, our ag and natural resources educator does spend a lot of time answering those questions. Mm-hmm. But of anyone in our office, he probably spends the most one-on-one time with a client. He may be out visiting their farm. He may be helping them with a research plot. They may be in here. But when he's with someone, they have a long conversation, and
he probably knows. I think as agriculture people, more personally about what is happening in someone's life and are able to assess what's happening. Teenagers and I'm as family and consumer sciences, people can hold it together for a short amount of time. But when you're walking around with someone on their farm, in their space, or at their business, you are in their domain and they're talking to you about problems and things that are going on. It's not always just let's talk about pesticides or let's talk about manure. So you can really assess what's happening with someone in a way that we don't always have the capability of doing. And that's the very first step, is to assess and to be able to look for and know, wow, what are they really saying to me? What is someone really talking about? And should I be worried about them? And if so, are you okay to ask the hard questions and then refer out from there?
Sure. And with 4-H, our youth are coming to us for one reason, and that's fun. Mm-hmm. They come to us already positive, the majority of them. when we have people come into our office for Mark, our ag guy, they usually are coming in with a problem. So sometimes they're not coming in with that positive that positive attitude already, because they're already dealing with something difficult that's going to impact their life a lot. So they're already kind of in the ag world, you already have that first, it may not even be a positive experience that you're going to have with this person, depending on what that problem is. So I just feel like the nature of the one-on-one relationship and the time spent together, it does open the door for you to be a support and a resource for those people.
And if you're not aware of it, one of the things with younger people is that they do tend to they're taking classes on this. They're learning about this in their high schools and their junior highs. So they already, when we talk about these things, are like, oh, I've been reading a book about that. Or, young adult novels are about that. Their movies are about that. Once you graduate and you get out into the real world and life sets in, that doesn't always happen. And just like you need to know what this plant is, or I need to know what a substitute for different sugars are for my diabetes clientele, we all need to be aware of what could be happening so that we can serve people better and help them, because it's not going to help anybody if we get into a downward spiral and don't treat the mental health problem that is existing. And how awful would we feel if someone in our community or our county experience something detrimental, because the layers it affects so many people, and it's such a hidden thing, because it's private.
Right. And I guess the point that we want to make to Extension is you don't have to be the expert on this. We are experts in a lot of things. This does not have to be one of them. But as an Extension professional, I feel it's very important that you know in your community who those professionals are and know how you can direct people who you find may be needing the additional help or are in crisis. How can you get them connected? So it could be as simple as going through some of your social services in your community and finding out what kind of programs they offer. I found out that we have a bipolar disorder support group in our community, along with AA, NA. So those two are kind of common, but I didn't know we had the bipolar support group. And my sister is diagnosed bipolar, and that's something that my family had never done before. I've lived here 27 years, and I've dealt with that problem for 27 years, but that's not something that I knew existed. So I feel like if we know what programs are out there, even if they're not our own, we need to be connecting people with ways that they can become healthier mentally.
And we need to make sure that, like Amanda said, the things that could be our own are hosting a mental health first aid training, which is an 8-hour class. They have one for adults, they have one for youth. For example, I'm going and taking the 5-day national certification so that I can be a trainer for our youth. We've unfortunately in our community surrounding areas had multiple suicides over the last 12 months. So I would love to go into our schools, into our churches, and to anybody who's got a teen in their life to come in so they can be aware of the symptoms. But we are not trained for that. We are not doctors. We are not able to prescribe medicine. So being okay to say, you know what, I hear what you're saying, and I understand that there's a lot going on right now. I have a great person and a number that I would love to give you, or could I go with you and can I walk with you through this to help you so that you can process and understand what you're experiencing.
So one of the things that you mentioned there was sort of being aware and being able to, assess what goes on here. And I know one of the things you covered in your workshop was this LG method. Can you give us a little brief synopsis of that, and maybe that will help people get an idea of maybe how you can start down this path? Hold on, you're muted. I muted you, so I'm gonna. You'll need to unmute yourselves.
Yay.
Okay, good. Mm-hmm. Can you hear us?
Okay.
All right, great.
Sorry.
So the ALGE method is ALGEE, and the first thing you want to do is you want to assess for risk of suicide or self-harm. And one of the things that we learned, which was not something that we had either one of us ever been taught, was that it's really important for you to say, are you planning to hurt yourself? Are you planning to kill yourself? Do you have a plan? Do you feel like you are going to hurt yourself or want to hurt yourself? That is something we've always shied away from. But it is important to point blank say, are you considering this?
And then the two big questions that they said are you planning on hurting yourself or killing yourself? And how are you going to do it? And asking that second question, how are you going to kill yourself? That's not a question that I'm comfortable asking anyone. It feels bad coming out of my lips right now. So learning that was kind of a shock, but it makes sense. If they have a plan, you need to know what the plan is. You need to get them help immediately, and you need to make sure that there's steps in place so that they can't complete that plan, whatever it may be. And a lot of the times they said, when somebody has a plan, if they're asked, they're ready to tell you because they want help. They want the help. They just don't know how to ask for it. So one of the things they had us do in this training was look at our partner and say, Jami, are you feeling suicidal? Are you going to hurt yourself? And it just is something that I'm continuously trying to practice because it's just if this situation is difficult, when you really are concerned about someone, it's going to be 10 times more difficult. But knowing that you can ask that is the A in algae.
And Amanda actually had a situation not long after that where one of the teens that she works with posted a song lyric that was very depressive and mentioned things like that. So she messaged them and said, hey, is this just you quoting a lyric, or are you planning on, I'm worried about you? And they, but you never know. So it's okay. If it's not anything, they'll tell you, oh, it was not a big deal.
She said it was just one of the songs that I'm listening to, but thank you very much for asking me. It wasn't like she felt like terrible or she didn't feel strange about it. She said, you know what, I'm glad that I know you care about me.
Yeah.
So back to algae, the L is listen non-judgmentally, which is difficult for us. No matter what people are talking about, our first reaction usually is to create that judgment in our mind. But in these situations, it's really important not to say anything like, wow, that must be really difficult, or wow, that's super selfish. Being the sounding board, somebody to listen and to provide the resources is important, but it's not our job to be this is good, this is bad, don't do this or do that.
And along that line, a couple of things that would be no-nos to say are things like, you'll feel differently tomorrow, or it's such a beautiful day outside, why do you feel so sad? Appropriate things to say are, I'm concerned about you. How long have you been feeling like this? So those open-ended questions and non-judgmental statements are something that they talk about in the course that, again, are very eye-opening because depending on your relationship with the person, you may think that you're being helpful, but instead it's just causing more anxiety or more depression. The next letter is G, and it is to give reassurance and information. And that is where it's really important for you to know who in your community can help you, where you can ask, do you go to church? Do you have a pastor? Do you, or have you ever spoken with someone about this? And to let them know that they're not alone in this situation, that it is very, very common and it's something that can be helped. So that's G, give reassurance and information.
And also just pointing out, it's nothing to be ashamed of. This is just like having the flu, just like having cancer, not in the sense that it's exactly the same, but this is a health issue and we need to address it, and you don't need to cover it up. The first E is encourage appropriate professional help, which it kind of goes with the G, but knowing who you can send people to, which we've already spoke to. And then the second E is encourage self-help. Find a way that you can make yourself feel better. Find a way that I can help you feel better, whether that's just hanging out and, going to Taco Bell, or if it's let's pray together, let's sing songs together, let's go for a drive, let's just talk every Friday at 12 o'clock during lunch. We'll talk, whether it's good or bad, we'll talk.
And then making sure that you follow up. If you say you're going to do something, make sure that you do it. We in Extension are very, very busy. And there have been many times, I've been with Extension since October of 2015. And there have already been many times where I have backed up appointments one to another and inadvertently missed a phone call or forgotten to respond to an email. That can't happen. So as you're encouraging self-help, let them know that you care and that you really do mean it. The other things are to connect some of your programming to different things. So if you know that they like knitting and you have a knitting group with your homemakers, then invite them to that and maybe go pick them up or have a yoga class or do a walking group. Really, anything to invite them and get them out. For those ag people who maybe are feeling, maybe it's you put a coffee group together and you've got a group of people meeting to just, sit down and chit chat or, whatever it is that, thinking of my grandpa and his farming buddies, maybe you need a Sunday afternoon where there's nobody doing anything kind of thing and just enjoying one another's company, trying to get people connected again and being responsible for that and doing what you say that you're going to do is so important in this situation.
Where can, if folks are interested in the mental health first aid training and maybe pursuing that in their organization or just individually, is there a good resource where they can find information about that?
Sure. What you're going to want to do is visit the Mental Health First Aid website, which is very easy, mentalhealthfirstaid.org. And what you'll do is it'll say, find a training, and you click on it and you put in your state and poof. Trainings everywhere. It's an 8-hour training. Some of them are one-day training. Amanda and I did 2 4-hour sessions, and they are certified, nationally certified instructors, and they're all over the country and totally worth it. Very eye-opening. I have an undergraduate degree in psychology, thought that I was pretty clued in. No, there was so much to learn and so much to do, and things are changing all of the time. So
the great thing about the training, 8 hours is a lot of time to dedicate, especially in our line of work. Mm-hmm. 8 hours away from the office sounds like a lot, but the training was very, very, very well put together. It was not a bunch of listening. It was activities and videos and conversations. And the conversations we had in our class, it was just amazing to see how these type of issues have impacted everyone in the course, whether it's through a family member or themselves or a client or a friend. Almost everyone in the room had 2 or 3 different stories they could share. And it just really, opened my eyes a little bit about this. There's a lot of work to be done, and I'm not saying that we need to do all of the work, but we need to be aware of the work, and we need to be able to lend that hand and that knowledge when it's needed.
And the other thing is that when you hear, at least in our line of work, that there is an 8-hour class, you assume that maybe it will have a high price tag. The majority of classes that we have heard about are very inexpensive for the time and for the knowledge that you are learning, because they're underwritten. In our area, it was the Partnership for Violence-Free Families. So there are grants and things that are available that are keeping the cost of this very low. So your entire office could go do the training very minimally.
When we went to the training, they charged us a $25 fee, and that was only for the manual that then we got to keep. And the manual goes through lots of different disorders and simulations of what you could do. There's a giant section on substance abuse. We're the #2 heroin county in Ohio, and so it's a really big issue for us and our youth and our clients. So it provides even more information than in the class, which it's nice to have now, because whenever I have a question, I can just reference that manual. And that was the only fee that they charged us for our course.
And it also tells you symptoms, things to look for, when to call 911. We practiced calling 911 and asking questions so we could discern. Mm-hmm. There's that A again, assess for harm and what you need to do.
Well, thank you so much for joining us. This is a really important issue, and I really appreciate you guys sharing your personal stories and for really highlighting this issue throughout cooperative extension. I think it's really important. You guys are doing great work. So thanks so much for joining the podcast. Jami Dellifield and Amanda Rains are both from Ohio State University Extension in Hardin County, and they've been joining us today talking about mental health issues and what cooperative extension can do to help people out. You've been listening to the Working Differently in Extension podcast. Thanks so much for joining us. Couple of notes: follow us on Twitter. It's at WDInEXT. You can find the show notes at bobbirch.com, and the audio is on SoundCloud, soundcloud.com/workingdifferently. Thanks again for joining us. Have a great day.